Hi all, I'm back with gynecology. Last week we had discussed about salpingitis, so today we are going to discuss about ophritis. Okay, ophritis is an infection inflammation of the ovaries, either one side or both side. We have a pair of ovaries, right? Then Oophoritis is typically a bacterial infection. Okay, so sometimes, rarely, it can also be a this one autoimmune diseases. Okay, now autoimmune diseases, like our own cell is not able to identify themselves, and because of that, antigen antibody reaction occurs. Okay, so I think so. Last year we had all discussed about this much, so I don't wanted to repeat it again. Okay, then etiology, we have bacterial infection, pelvic abscess, STDs, sexually transmitted diseases like chlamydial and gonorrheal infection, IUDs. IUDs is intrauterine devices, the devices which we insert, okay, to the uterus to prevent pregnancy. For example, I can say cockpoti, then lipper loops. Okay, these are the instruments which we insert so that we can prevent the pregnancies. Okay, this all can be a cause for ophritis. Okay, miscarriage, ectopic pregnancy. For autoimmune ophritis, the exact causes are known. That means it's idiopathic. Okay, now clinical manifestation. Actually, in clinical manifestation we can say the symptoms are not reported because this is usually seen in while menstruation. Okay, while a menstruation is occurring, this all symptoms will be seen in a woman or in a girl. So this signs and symptoms will not be reported. So at the last time only, at the end stage only, we will be reporting the doctor about this. Okay, because there will be pain in the lower abdomen. It's a normal usual signature of menstruation. Okay, then bleeding, menstrual bleeding heavier than the usual. Okay, that the person will be thinking, I have more HB, because of that I'm bleeding, right? We have extraordinary thinking level. Then heavy vaginal bleeding with foul smell, burning sensation, dysuria, low back pain, fever, chills, and all. These all symptoms are present there. But one classic symptoms of ophritis is like a person when a menstruation is actually 28 days. Okay, normally it is 28 days. Some person it can lead to 30 to 31 days. Okay, so actually what happens is like once the woman is bleeding, okay, once the menstruation start, after 28 days only the next bleeding occur. That is a cycle. That is not a menstruation cycle, right? You have learned in your anatomy, right? So in ophritis, what happens, like between this, once the woman is bleeded, after 28 days only, usually the person will bleed. But here what happens, like in between also they will be bleeding. Okay, in between 1 or 2 days also they will be bleeding. After that again, it correct 28 days again they will be bleeding. So there will be a confusion. Fine, this is the classic symptoms of ophritis. Now moving on to the diagnostic evaluation, history collection, physical examination, laparoscopy, blood test will be done, especially for diagnosing STDs. Okay, so vital test will be done, then laparoscopy, pelvic ultrasound will be done. Okay, regarding surgery, what is the exact cause? According to the cause, the treatment will be given. If it is a bacterial cause, antibiotics will be given. Okay, if it is a STD, sexually transmitted diseases, according to that, the treatment will be given. Okay, so symptomatic treatment, if it is antibiotics, can be given because the person is having fever, chills, and all. Fine, antibiotics will be given. Analgesics, pain is there for the patient, like lower abdomen and back pain is there, so analgesics will be given. Okay, symptomatic treatment. Then for autoimmune ophritis, we will be giving HRT, that is human replacement or hormone replacement therapy. Okay, then surgical management. See, in our course, we had discussed about pelvic abscess. So, abscess is pus formation. So, when is the pus is formation, we have to drain it out, right? So, through surgically way, we will be draining out the pus. That is a surgical management done as per the cause. Okay, I hope you all understood this ophritis. And if there is any doubt, please get back to me. So, ophritis is a small topic. Okay, it's an infection, inflammation of the ovaries. It can be either one side or both the side. Okay, usually it is a bacterial infection, or we can say it might can occur due to STD, IUDs, ectopic pregnancy, etc., etc. Okay, clinical manifestation, main one is bleeding between the menstrual cycle. Okay, rest is the same. Fine. Then in diagnostic evaluation, main is laparoscopy and pelvic ultrasound, and management is symptomatic treatment. Surgical management, if the person is having pelvic abscess as a etiology, then we have to drain the abscess. That will be in the surgical management. I hope you all understood this, and if there is any doubt, please get back to me. Thank you. Have a nice day.